Hi, I'm Dr. Castanet. I'm going to explain to you the cause of neck and back pain 98+% of the time. And it is as a result of the slow, progressive degenerative process that happens to our spinal discs. When we're young, as children and as adolescents, we impose lots of physical demands on our spines. We do continue as adults as well, but the degenerative process starts quiescently when we're children. And the way it starts is that, and I'm going to use a model to describe this, but this is supposed to be a model of your spine. This happens to be in the low back, but it could be in the neck as well. The anatomy is similar in the neck and the low back. This would be the back of your spine, where you can actually feel these bony prominences through the skin. In the front of the spine, you have the vertebral bodies here. There's a disc in between, and there'd be a disc below and a disc above, and you'd have additional vertebrae above that, like that. But what happens over the course of our lifetimes is the discs, which are a little like jelly donuts, they're made up of 12 to 25 concentric layers of tough connective tissue on the periphery that go around and around in circles. And the inner part, the consistency changes to a soft tissue substance that imbibes water and absorbs water. And then as loads are imposed vertically, such as when we're upright or seated, the loads are transferred from the center part of the disc to the walls of the outer disc area. What happens from physical demands is that the inner part of the disc starts to wear out, and over time this progresses and migrates to involve the outermost fibers. At some point, the outermost fibers are involved. These are innervated and have a nerve supply, so you can perceive pain that's associated with injury to the outer fibers, but you don't perceive pain when you're younger to the inner fibers that are accruing damage over time. The healing process is imperfect. During the course of the day, you impose physical demands. Little micro traumas occur to the disc material. They aggregate over time, and you have to recover during the course of the night. When you lay down and there's less load on your spine, that's when the disc, which can be likened in this circumstance to a sponge, imbibes water, nutrients, oxygen, and goes through a healing process. But typically over the course of a time, at one or more levels of the discs, the repair process can't keep up with the damage process, and so there's a slow progressive degenerative process. This is undoubtedly a function of a lot of variables, including genetics. We know that to be the case. It's also a function of nutrition, as all things in the body and physiology and anatomy are. And so over the course of time, we wear out. Some people surprisingly wear out very quickly and badly at one or more levels. Other people, they're probably rare, don't seem to acquire much in the way of degenerative changes. It could be for a variety of factors. There are many variables that influence this. How much weight you carry, whether there are any congenital anomalies to your spine, occupations. We know, for example, that some risk factors are being male, driving professionally, doing heavy material handling, and being a smoker. All of those either impose greater demands or compromise the repair process. In either case, the net effect is an increase in the degenerative process to the disc. So that's what happens. Over the time, that gives rise to pain, not just from the disc, but from the ensuing degenerative changes to the bones, because the disc functions also like a shock absorber, so that if the disc is compressed over time, slowly compressed, it provides less cushion for the vertebrae. The vertebrae, bones, then respond by getting larger in response to the stress to accommodate it, and when they get larger, they become deformed, as this vertebra is, with some spurs, some lipping here. The joints then, which are made mostly to guide weight and influence the direction of movement, instead are made to bear more weight and as a result of that, they also enlarge. All this process, including enlargement of ligaments that are associated with the spine here, all of these make the space here in the canal for the nerve roots to descend to the legs, makes this space smaller. And we call that stenosis, or narrowing of the canal. You can also get narrowing here on the side, again as a result of all of these changes. Disc changes, joint changes, ligamentous changes, vertebral body changes, a host of things. Some people even have the misfortune to be born with a smaller canal than usual, but that's not real common. Perhaps that's maybe 2 to 5% of people, something like that. In any case, how best to treat this? Well, recall from what I said a moment ago that we recover when we lie recumbent at night, and that lowers the pressure in the disc. That permits water, oxygen, and nutrients to be absorbed by the disc and to do the reparative process. Well, it so happens that we can predictably influence animal discs mechanically by distracting them in a favorable way. If you pull the vertebrae apart and distract a disc, it's like repair on steroids, so to speak. It gets more water, oxygen, and nutrients in here. It gets pressure off of the ligaments, joints, discs. It improves the status of the disc. And in animal models, if you do this, and we are animals, so this likely happens in our discs as well, the cells which find themselves in a better environment will multiply and make more cells, and those cells will make more molecules to repair the disc. All of this has been documented and all of this has been quantified. There's a significant many-fold increase in reparative molecules when you distract a disc. So this needs to be the major approach to treatment of back and neck pain, not just for the acute injury or pain that you may have, but also to improve the prognosis of your spine and make your spine last as long as possible. As more and more of us approach our 80s, 90s, and 100s even, in the next several decades, this spine is going to have to last a lot longer. Degenerative changes are going to have to be ameliorated and dealt with. Otherwise, we're going to spend more and more of our lives, our latter lives and years, with pain and disability. So the way I treat this, and have for the last 9 years, and let me say an aside here for a moment, I've spent 28 years in this field. The first 18 years in orthopedics, physical medicine, and physical therapy. The last 9 years independent, using a treatment I'm going to describe in a moment. And when I went independent, I spent an additional 4 years part-time in a neurosurgical clinic, because I'm very interested in determining what works, how, when is surgery indicated, when is pain management, such as injections, indicated, and when are non-surgical treatments indicated, and how effective are they relative to each other. So in my 28 years, I've used many, many different non-surgical treatments, and I can tell you that by far the most effective treatment approach is an approach I described earlier. I place people face up on a table. The table is a gentle means of separating the vertebrae, opening them up, getting more water, oxygen, and nutrients into here, and improving people's pain. Generally, if you do that, people will respond quicker and better, so they will get more improvement and get improvement quicker than any other means of treatment I've found. Most means of treatment right now, the prevailing approach is to treat the pain without addressing the mechanical cause, and it's to strengthen the muscles around the spine. That's fine as an adjunct, because strengthening your spine enables you to protect your spine more effectively when you're doing physical demands such as sitting, bending, lifting, all those sorts of things. But that protecting the spine is not sufficient to make this problem better. In fact, it's independent of that. It will not influence this source of pain. So the most effective treatment I've found in my 9 years using this treatment is spinal decompression treatment. I place people on the table, as I said, secure them to the table, and the table very gently and slowly separates the vertebrae for the course of a half an hour. This is a progressive means of treatment. You will need some number of treatments depending on whether your problem is mild, moderate, or severe. If you do that treatment, it gets people over their acute injury and it improves the future prognosis of their spine. That, I think, is the most rational and, in my empirical practice, the most effective way to treat these problems. I'd love to be able to help you with your neck or back pain. It's effective for both neck and back pain. I'm in Decatur, Georgia, and I see people throughout the Atlanta metro area and throughout Georgia, in fact. So if I can help you, please give me a call. My name is Dr. Castanet. I'm in Decatur, Georgia. The number is 404-558-4015. Thanks very much. Bye-bye.